name is Simone Betchen. I'm a neurosurgeon at Maimonides Medical Center, board certified in neurosurgery. I went to undergraduate at the University of Pennsylvania in Philadelphia. Then I went on to do my medical school training at Johns Hopkins in Baltimore, Maryland. I did a general surgery internship at Mount Sinai in Manhattan. I stayed on there to do my neurosurgery training as well as my chief resident year there as well in neurosurgery. And then I completed my training at Memorial Sloan Kettering doing a fellowship. I've always loved neuroscience and really have been fascinated with how the brain works, and in turn, really how the brain then controls the rest of the body. The second part of that is really that I'm more interested in the surgical side of medicine. I like the idea of taking a patient to the operating room, fixing a problem with my hands, and having a solution. Some of the things I take care of are herniated discs of the neck and the back, spinal stenosis, tumors of the brain and spine, Chiari malformations, hydrocephalus, just to name a few, but that's certainly not a complete list. There's two main things. The first one of those is really a team approach. And I think that idea sounds pretty simple, but it shouldn't be underestimated because it's not done everywhere or by every doctor. Oftentimes, when I see patients in my office, before I ever offer them surgery, I will send them to a team of doctors, including a neurologist, potentially a physiatrist, a pain management doctor, so that I'm not really making a decision in a vacuum, and I know that everybody is on the same page as far as the patient's care and well-being. The second trend that we're seeing in surgery and in neurosurgery as well is technology in the operating room and a minimally invasive approach. These are special tools that you can use in spine surgery to have smaller incisions, less blood loss, less post-operative pain, and hopefully less hospital days. I try to always explain the films to them, show them what's going on so that they can understand what's going on as well. Then I try to make them feel comfortable, assure them that we're going to treat them like we treat our own family here at Maimonides, both in the operating room and afterwards. Assure them that I'm always going to be there for them, that I'm going to be seeing them every day in the hospital, that I have a staff here that is well trained in neurosurgery, from nursing to our PA staff that's here 24 hours a day, and that there's always somebody on hand that's going to be taking care of them. And I think that knowing there's somebody just around that's on your side is helpful to the patient. The most important thing to me in treating a patient is to follow the Hippocratic oath that we all took the day we graduated from medical school. And the most important thing in that is, in my opinion, is first do no harm. And so as a surgeon, it's part of my job is to know not only when to operate, but more importantly, when not to operate. I try to treat every patient like a family member. If I recommend surgery, it's because I would recommend it for my own family in a similar circumstance. As a physician going through medical school and residency and then life, we all have moments that we're proud of and awards, achievements that we are given. But I think for me, the most special moments are when I see a patient post-operatively, either in the hospital or in the operating room, with a smile on their face, and I know that they are no longer in pain, or their disease has been cured, or their function has returned. And every single time that happens, that's really a special moment.